Hi, and welcome to Community Essentials. I am Faye, your guest host for today. And today we're talking with Martha from Angel Home Health Agency Service. How are you, Martha?
I'm good, and you?
I'm just fine, and thank you so much for being with us.
Thank you.
Now, tell us what a home care agency is.
A home care agency is a care service for people in the comfort of their homes. We help them with grooming, feeding, meal preparation, bathing, and also medication reminders for the elderly or the disabled population. For people who can't go out to do things for themselves, the caregivers can help them with grocery, with laundry, and with going to pick up their medications from the pharmacy. So we help them to help themselves to do things that they cannot do for themselves. There are people who can live fairly independently in their homes. They just need a little help from people to prepare their meals or to take them out for their doctor's appointments. So that's what home care is all about, to make people live comfortably in their house with a little assistance from a caregiver.
Now, to run an agency like this, you have to have a lot of empathy. You have to have a lot of compassion. So what was your inspiration and your passion for starting this kind of agency?
I've always had a passion for the elderly and for the disabled population. When I was in Africa, my grandmother was in the hospital, and she didn't have any help, so I had to go help her in the hospital.
Okay.
So that kind of like motivated me to help people. It created like a huge passion in me to help people, because I have seen someone that needs help, and if she did not get that help, it would have been so tragic for her. So that kind of motivated me to take care of people.
And so how did you get started in business? Did you just think of it and go to someone and talk about it, or did you just decide on your own and invest yourself? How did you get started with something so beautiful?
Okay, yeah, I'm a registered nurse by profession, and I did bedside nursing. And I liked it so much, but I didn't have that personal touch with a patient, because, I mean, it's what you have, like one nurse to like 8 patients.
Wow.
So you're running around giving IVs, giving medications. You don't really have time to sit down and talk with them and hear their story, and show that you care for them. So I found an avenue in home care.
Okay.
In home care, you are in the comfort of the patient's house. You are in the home, you are talking to them personally, you are sharing their stories. So they become just like family. So, and I really liked it a lot, because you are able to help them since it's one-on-one. You are focusing on just one person. So that was how I started. So when I now worked for a home care agency and I experienced this friendship with my clients and my patients, I said, you know what, I really need to expand on this and have my own home care agency so that I can take care of these people in my own personal way. So it really made a lot of difference for me.
That's fantastic. So what was the difference did you notice a difference between people who had home care and maybe someone who did not? I know some people who needed home care, and it was almost impossible to get, but they needed help with bathing, etc. And sometimes they were a bit depressed because they couldn't get the help that they needed. So what do you think the difference is between someone who can get home care and the person who can't? Have you been able to check that out when you would go back and see a patient, or did you notice something different when you decided to do home care?
Okay, for people who don't have home care, is a huge challenge for them, because sometimes some of them will not even remember to take their medications.
Okay.
But if the person has a home care aide, the home care aide will ask, have you taken your medicine today? Have you taken your morning medications? Although they are not expected to pass medications, but they can remind you to take your medications. Some of the elderly can't even, they are kind of frail. They can't even move around well to go get water to get their medicine. So all these have a huge impact on their health and their well-being. You know, some can't even shower. They will want to shower, but they don't have the energy, they don't have the strength to do this. So people with home care, people who have home care available to them, they live more fulfilling life and they live a better life. And they also live a longer life because, I mean, they really want to live well, but they don't have the dexterity, they don't have the strength to do this by themselves. So home care improves their health and improves their well-being.
So now where are these people's families?
Some of them, many people don't have families, or their families are at work. So when their families are at work, they need someone to take care of them. Some of them are able to take care of them during the weekends. But what happens on weekdays? They have to go to work. So they really need a caregiver, a dedicated caregiver to take care of their loved ones. So
definitely. So tell me why you think, is it because we have more elderly people now? Why do you think there's such a need for home care in the United States? And you're from Africa, you're from Nigeria.
Yes, yes.
Why do you think there's such a need for that right now?
Yeah, the American population, I would say, is aging. And with that, it increases the need for home care. Because a couple of years ago, nursing homes used to be like the thing for people who get older.
Okay.
But in the nursing home, it's like a regimented life. They all shower at the same time. They eat their meals at the same time. You do what your roommates are doing at the same time. But that personal touch is not there. For instance, some elderly people or some people might like to shower in the morning.
Okay.
Others like to shower at night. So when you have home care, your care is tailored according to your specific needs, according to what you need. Some people wake up early. They might like to have their breakfast like 8 o'clock in the morning. Someone wants to have their breakfast 10 o'clock. So, I mean, in the nursing home, you are I won't say forced, but you are compelled to do things according to a schedule. But in home care, you are treated as if you are in your home. They do things for you how you want it to be done, for you what you like. They meet your needs in your own home. So home care is really beneficial because the American population is aging fast, and many of them are still fairly independent. So they want to live independently in their homes if they can have a little help from caregivers to provide them with bathing, grooming, meal preparation, accompanying them for their doctor's visits, reminding them to take their medications, and just light housekeeping, doing their laundries. So.
And you have a special relationship with the Department of Aging. Tell us a little bit about that.
Okay, the Department of Aging is a government organization that takes care of elderly people from age 65 to like 100 or to whenever it's caregiving for people who are 65 years old, 65 and older. So they provide care or caregiving service for them. There are different organizations like Catholic Charities Care Solution that work with the Department of Aging to provide caregiving service to this elderly population. So they work with different home care agencies like mine to provide care for the elderly.
That is fantastic. So what area do you serve?
I serve Angel Home Health Agency serves 6 counties. We serve Will, Lake, Kane, Cook, McHenry, and am I missing any county? We serve 6 counties. We serve DuPage, Will, Cook, Lake, Kane, and McHenry counties. But for the most part, many of my cases are coming from the Oak Park, Oak Park, River Grove, Hillside, Maywood, Melrose Park, and west side, and some south side of Chicago. But we serve these 6 counties, though.
Okay,
Yeah.
and you know I gotta ask this, but as a black woman, how was it in trying to start your business? Because I know a lot of people always want to know that, so I make sure I ask everybody. As a black woman, how easy or hard was it starting your business?
Well, I got help and support from a lot of black sisters, because there were some sisters who have started a business before me. You know, I tried to like do it on my own. I mean, I went to the website, I went to the IDPH website to get a license as a care provider. It was tough though, so I asked for help from some sisters who are already in the business, and they helped me to navigate the system and all that, and it was easy. So
That is
it was
fantastic.
okay.
So they kind of mentored you
Mentored me,
through
yes.
the process.
Yes, exactly.
So as far as getting assistance from the government, because do you get assistance from the government, or is this all profit? What I mean is, do you get grants for the aid for the elderly?
No, we don't really get grants for the elderly. We just get reimbursed for the services that we give to the elderly. So we don't really get grants like that. But I think the government is doing a good job helping the elderly to pay for the service, because they don't really pay anything out of pocket or nothing. It's just a service that's paid for by the government.
So what do you think, how do you think they could help you a little more, the government? Because like you said, our population is aging. I think next to the millennials, the baby boomers are like the biggest population. So is there anything that the government can do to assist you with helping take care of your, with your home care agency?
I think the government, they have done a lot, but one area I would want them to improve is to make sure that there's a bigger outreach to all the seniors, because many of the seniors do not even know that this kind of service is available to them. So they should have like an outreach program to let the seniors know that if they will need this care, that the government is available to help them, because they really need this help. They really need the help.
And what are some of the avenues of outreach do you think would help? With television, a neighborhood passing out flyers, word of mouth? What kind of advertising do you think it should be, a commercial on television, or what would help you get the word out?
I think a commercial on television would help. You know, or because I don't think seniors go online. They don't.
I was
have
just going to
time.
ask you about Facebook.
They don't have time. Some of them do Facebook, though, but not all of them. So, but I know a lot of them watch television. I go to their homes, you know, they are watching those old shows and all that. That was so interesting. And I sit down and watch the shows with them too, and we just laugh, you know. So I think a television outreach would be quite beneficial to get this out to the seniors.
Because then that way they would see it instead of watching the infomercials. What do they call them? Infomercials at 3 o'clock in the morning. Now, you were telling me that you had a great need for some employees.
Yes.
So tell me why that there's not enough people that want to work and or know about the process of getting with a home care service.
I just feel that, you know, I mean, a lot of people want to work, but they are not aware of how to apply, or they're not even aware that this kind of job is available. So that's why I'm trying to let them know that Angel Home Health is ready to give them employment. So, you know, that's another outreach they need to know that the jobs are available. I have gone to Indeed.com to like advertise, but maybe not all of them go to this site. So, and I believe a lot of people watch television, so they should be able to like hear that we need employees. What we require from our employees is a a high school diploma. We do fingerprints. We do the backgrounds because we want to be sure that credible people are working for us. And we also need a health clearance. We make sure they have the chest X-ray to be sure that they are free from TB or any infectious disease. And they should be people that really have a passion for what they do, because caregiving is a job you do with passion, you do with so much love. I know you earn an income, you earn money from it, but you should have passion for the people you take care of. So.
And how do you decipher if they have passion? You just sit down and have a conversation with them when you're talking about them being employed? Because I know I had a friend, like I said, that had some people that were kind of good, really good, and there were some people that were not so good. And so she had a little difficult time because she couldn't really interview them. So tell us about the interview process. Do you just have a one-on-one and kind of go, because I know that you are very insightful. So for instance, if you were interviewing me, what would be some of the things that you would be looking for?
We interview people. I would like to see that you are a team player. From interacting with people or with someone, you would know if they have a passion for what they do. And also we do training, because the major part of this thing is for someone to know their job description. Some people don't know what is expected of them as a caregiver. So we have a 24 hours online training where we train our caregivers. We also train them in the homes, because every client is different, okay? The care we provide is specific to the need of that particular client. So we do training in the home. We watch what they do and correct them.
Okay.
We observe them for 1 week, and we also do follow-up every month. Follow-up, we ask the client, how is everything going? We also check with the worker, how is your care going? Is there anything you need? Do you need assistance? How can we make it better? So those are the checks that we do to make sure that things are going well.
I know you said in the green room that you try to pair people with what they need is very individualized. So when you go to a person's home, and how do you decide what kind of care? Do you like walk through or see what they're, a health analysis? Do you actually see what they can do? Because a person can tell you, I can't wash dishes, and be able to. So do you have someone come there and just, sit with them? And because like you said, everybody's different. So do you have them fill out some paperwork or?
Yeah, like we have case managers from the state. They go do a need assessment with the clients in their homes before they even bring their cases. Before they even turn in their paperwork to us, they do a need assessment that the client needs help with dishwashing, the client needs help with feeding, the client needs help with grooming, the client needs help with medication reminder, the client needs help with laundry. So we, right from the word go, we already know what the client needs. So we will show the job description to the caregiver that this is what you are expected to do. And when the caregivers, when they fill out an application, we make them check the skills that they are comfortable doing. So if we know what a particular client requires, we match those skills with what the worker can do. And for the most part, most people know how to do everything because they do the same thing in their homes.
Right.
You do your laundry, right? You do your laundry, you do your dishes, you clean your house, you mop the floor.
Clean the bathroom.
Yes. They are not really like skills you have to go like learn in school. They are things you know how to do, but we'll also check that you really know how to do them or you get trained for doing the skills.
And how do you determine how many days that a person can have that home care available to them?
Okay, we don't make that determination. The determination is made by the caregivers from the Department on Aging. Like I said, they go do a need assessment in the homes and see and and ask them, what do you need help with? What do you need assistance with? And they also look at the physical characteristics of the client. Some people are just bedbound; they can't get out of a bed. So you know that that kind of person needs a lot of help. So for those clients, they have more hours because they need more care. So they make that determination based on what the client tells them or what a family member tells them, in case the client cannot talk for themselves. So they tell them, this is what my mom or my dad needs help with. And they also look at the client, and they also look at the home environment to see what the need would be. So.
And how long does this process take? For instance, if I needed home care and the state of Illinois came out and assessed me, how long would that process take from them interviewing me to getting approved to getting me to Angel? How long would that take?
Yeah, like I said, it's a case-by-case assessment. For instance, there are some people who just got out of the hospital and they need a lot of care, or they need immediate care. We call the term that they call it interim. That means that client needs help within 2 or 3 days in order not to go back to the hospital.
I see.
Yes. So the case managers from the state, they now send the notice to different agencies. Hey, this client needs care. Please, can you provide? If you can't, just let me know so that I can forward it to the next agency. So for those, they get care within 2 or 3 days. Then for people who are not, who are in good shape, but they still need help, it takes like 2 weeks for the agency to initiate care. But it's always good to start giving them care in 10 days. So every case is different.
Okay, now we were talking about your need for employees. Tell me how the need for employees can help your business grow well at the same time providing that service to the aging. Because if you don't have employees, you can't meet the needs of those aging. So is that part of the reason you need employees right now?
Oh yeah, there you go. Thank you so much. Thank you for asking that question. You know, it's really huge for me because I really want to take care of the elderly. Sometimes I find myself almost going there to take care of them, and I actually do. When I don't have help and I see that, oh, this client really needs help, I just squeeze out a little time, but I can't do everything. I can't be there all the time. I can't be there every day. I can be there like twice a day because I have administrative work to do. So I really need people to know that we need employees. We need to employ people to take care of the elderly, you know. So if they can contact me and come fill out an application, that would be nice.
Oh, I'm sure they will. You have a very big heart. You're looking for people with good hearts.
Yes.
So now, what do you think will be the outcome of people who actually get home care vis-a-vis being in hospice? Because I know you go to hospice when something is terminal. But in order for you not to get there, do you think your service helps with people being taken care of so they won't end up in that place? Maybe they'll live longer because they have better care. So do you think you help in that aspect? I know you were talking about interim, but of course we all want the aging to be taken care of properly, which sometimes can, they can be sick if they're not. So what you're doing is almost an essential part of caring. It is an essential part so that they'll remain healthy or get healthier.
Yeah, people love their homes. People love to be in their homes, you know. So if we can keep them in their homes, we can make them comfortable, we can make them happy, they will live longer and more fulfilling lives. You know, people don't want to, I know the nursing homes are good, but and nobody really wants to go to the hospital. So if you take good care of them at home, they will live longer and they will live happier lives. So
you really love what you're doing. You're glowing.
I love I love home care. They are more or less, you know, they become like family to you. You know, you see them, you laugh, they joke, they tease me. Oh, you adding weight. Oh, you're slimming down now. What's going on? They become like grandma, grandpa. It's really very rewarding.
So give me an
Very
example of
interesting.
somebody that was just wonderful, that you saw the difference before they came or when you started and with working with them. Give me a little personal story.
Okay, I have one lady. She was getting only 2 hours because, sometimes when the state comes to do an assessment, they don't like tell them everything. They don't like tell them like their personal stories or what is going on with them. Maybe they feel shy to talk. But when I went to her house to do like a follow-up assessment, so she was telling me that, you might think that things look okay now, but my husband is recently diagnosed with dementia, and
Wow.
it's getting too hard for me to cope with him. My knees are hurting. I can't be running around him and all that. I will want my hours increased, please. She was getting like only 3 hours, 3 days a week. That's like 9 hours a week. So she told me to contact her case manager and like ask for an increase in her hours, because we can't increase their hours. It's up to the state to increase the hours. So I was able to contact her case manager, and her hours were increased. So the next time I called her, oh my God.
It gave you joy.
She said, "You are an angel. I don't always like people like that, but when you came to my house, I just like you. You have something about you." I said, oh my God, that really made my day. I was so happy that I could assist her to increase her hours, and she's happier now.
So you were her angel, just like the name of your company.
Yeah. Oh, I'm so thankful. I'm thankful. I'm thankful. I'm thankful.
So now the employees, you said you want them to get in touch with you.
Yes. The name of my company is Angel Home Health Agency Service Corporation. We are located in Westchester. My phone number is 630-251-1046. And our office number is 708-410-2007. We'll be happy to meet you.
And I'm sure they'll be happy to meet you.
Thank you.
And thank you so much for joining us at Community Essentials. We'll see you next time.
Thank you.